The Uganda AIDS Commission recently released a report showing that there had been a slight reduction in the number of people infected with HIV annually, from 53,000 in 2019 to 38,000 in 2023. This indicates an infection rate of 5.1%. This same report shows that Fort Portal City has the highest infection incidence at 14.1%, followed by Soroti at 12.5%. Buyende District Chairperson Michael Kanaku explains that the infection rate is rising there due to inadequate access to health care.
The proximity and access to health services in Buyende is too low and undesirable. Staffing level in the health sector is 22%. We have more than 8 sub-counties without a health center too, and yet the tests are done in health facilities.
Kanaku adds that the high rate of poverty in Buyende has pushed more youth, especially women, into habits that predispose them to infection.
Other people drop out of school. The moment children drop out of school, then anticipate the next agenda is marriage, loving around.
The Buyende District Chairperson is concerned that many of the awareness programs are not registering impact on the ground as seen by the infection rate there. In return, Uganda AIDS Commission's Dr. Vincent Bagambe explained that women, especially those under the age of 24, are the most affected, and he explains why.
Below 30 years, most of the new infections are occurring amongst girls. But when you look at the age group, if you look at the category of men, then the new infections are occurring more frequently in men above 30 years.
In this regard, the experts are now calling for stern measures to curb infection if the country is to register success in its plan to eradicate HIV/AIDS infection by 2030.
The country needs to increase domestic funding in order to end AIDS as a public health threat. And so recently you will have heard us as the media talking about sustaining the HIV response, making sure that the government increases its responsibility.
Public access for HIV information is no longer there, and studies had indicated that only 40%, about 40% of the young people have access to comprehensive HIV, looking at the issues of causes, transmission, and management. So young people should advocate that there should be information.
The call comes as the country prepares to mark World AIDS Day on December 1st in Buyende District.